Hi, I'm Dr. Jasleen Chhatwal. I'm a psychiatrist by training, and we'll be talking today about anxiety. Anxiety disorders are of various types, as we've mentioned and spoken about over the last few weeks. In typical anxiety disorders can create a feeling of restlessness, cause worrying thoughts, also cause other physical symptoms such as feeling like your muscles are tense, your shoulders are really tight, sometimes it's difficult to breathe. And so when we think about the various anxiety disorders, the first main category is generalized anxiety disorder. That is a type of anxiety disorder in which this whole spectrum of symptoms can present. Usually a person might identify themselves as being a worrier and may feel like most of the time for most things, they tend to worry more than the average person. And also that these things may cause them more restlessness, more tension, and hence not be able to function as well on a day-to-day basis because of these worries. Another category is phobias. These can be specific phobias around specific events. So, when you think about having difficulty speaking in front of a public setting, so public speaking, it can be phobias around spiders, it can be phobias of heights. And all of these phobias are typically fairly transcribed around a specific situation. And what we notice is that when that person is faced with the idea of being in a high building or another higher altitude location, they may get really worried. And similarly, what we notice is that sometimes these phobias can be so severe that just thinking about that situation can cause a feeling of severe anxiety, tension, and worry. When we think about another category of disorders, we may think about panic disorder. Panic disorder is a criteria of anxiety disorders in which an individual can feel that sudden sense of anxiety, feel panicked, feel like their heart is racing, sometimes have a feeling of doom that makes them think they might die. So often a panic disorder can be confused with a cardiac event such as a heart attack. And so sometimes we find that these individuals get diagnosed only when they go to an emergency room with symptoms that seem akin to a heart attack. And then when cardiac tests are negative, the doctor may be able to tell them that it may have been a panic attack. What happens in panic disorder is that there can be worry about having these repeat panic attacks, and often these panic attacks come without any real warning. They can occur in any kind of situation, so there can be this combined worry about, oh my God, when will this happen again? And will I again be disabled while I'm doing something that's just common in my life? One other category of anxiety disorders is agoraphobia, and that is typically anxiety around being in crowded, busy places. So say going to a grocery store, going to a fair or a market can be very stressful for these individuals. And agoraphobia can present with or without trauma symptoms. And so that's another thing that we try to assess when we're looking for anxiety disorders. Previously, when we would look at anxiety disorders, we would also look at obsessive compulsive disorder, which was another type of anxiety spectrum disorder. Now in our DSM, we put it in a different category, but really from a clinical perspective, it also causes a lot of anxiety, so definitely needs to be considered. And PTSD, which we spoke about a few months back, or trauma symptoms can also present like anxiety. So there are a lot of things that can mimic anxiety. And so getting a good diagnosis with a clinician who understands your entire history and is able to take into account the uniqueness of your presentation is really important. Our nervous system has two main parts, the sympathetic system and the parasympathetic system. Anxiety and symptoms of anxiety typically fall in the sympathetic realm, which can be associated with excitation, increased activity in all the various systems that make us move and do things. So when we think about anxiety in the body, we typically notice that we feel tense, often increasingly awake, a little bit too aware of what's going on around us. We can notice that level of hypervigilance going up, and also we notice other things that are associated with excitation. So noticing your heart beating faster, noticing that your palms are sweaty. sometimes having this readiness in your body, like you can either throw a punch or run away. And then we also notice that when that anxiety becomes more chronic and is present almost all the time, that we actually go into a state of fatigue. And so there can be a sense of depletion, low energy, feeling like your limbs are really tired, you feel really not able to do things that you typically would, can't pay attention in the ways that you would want to. And that sense of going from excitation when it's acute anxiety to going to a sense of depletion is really the sign of where we can go from an acute anxiety condition or disorder to moving into more chronic generalized anxiety. There are many changes that we can make to our own lifestyle that can help with one, increasing tolerance for anxiety and anxiety symptoms, and second, actually increase grounding so that we can improve the symptoms of anxiety. When it comes to the first set of things that can help reduce symptoms of anxiety, making some changes so that you're exposed to events that increase anxiety levels, especially when they're more so phobia type or increased panic type responses, can be helpful. Obviously, trying to cut out toxic relationships, looking at ways that you may be increasing your level of stress and anxiety can be very helpful. And also, one I would recommend practicing some breathing techniques, some breathing meditations that can help start increasing your parasympathetic tone. So if you look up breathing exercises, you'll typically find box breathing. That's a popular form of breathing. There are pranayama exercises, which can also be helpful. I've actually done some recent reels on that on my Instagram, so please feel free to look at those. And then other techniques in the moment can be grounding techniques, such as noticing things with your senses. So it can be noticing fragrances around, or it may be noticing colors in your environment. It may also require you to feel textures. So I may feel the chair, I may feel the pillow, I may feel my dress. Some people also feel that when they're very anxious and have a hard time staying within their body, they may use something that's a little bit more drastic, like holding an ice cube, that really helps them come back as well. But typically those can be the more stronger type of techniques, like holding an ice cube, help a little bit more with dissociative experiences around anxiety, and using something like breathing as a basic tool or feeling different sensations can be more helpful when it comes to a generalized anxiety type of situation. And then for the second category of things that help you build tolerance, that can be techniques that may fall under the CBT realm of therapies, where we may start to look at our thoughts, be able to journal them, and really assess and reassess how dangerous that situation really is for us. And we typically find that in terms of lifestyle changes, they do take a long time to take effect and for us to see an impact. And that's where working with a therapist or a trained physician who does psychotherapy can be very helpful, because it helps you stay on track, and it also helps you move through the difficult stages. As human beings, we're typically, when we come up against some sort of challenge, we want to just take the easy path, not deal with it, because it feels good in the moment. But really working through some of these difficult stages with a clinician can be helpful for you to push through those events and make sure that you are continuing to work on improving anxiety and reducing the limitations it puts on your life. Thank you so much for listening today. We'll have one more week talking about anxiety, so please let me know if there's specific questions you have around anxiety for the month of April, and keep on tuning in every Friday to Friday Facts. Bye-bye.